Carbohydrate Counting Practical. Over the next few slides, there are a school menu, food labels, and pictures from Carbs and Cals. Using these resources, please work out how many grams of carbohydrate are in each meal. The answers are given later in the presentation. Calculating insulin doses. When calculating insulin doses, the amount of rapid-acting insulin, Humalog, Novorapid, Fiasp, or Apidra, will depend on the amount of carbohydrate in the meal and the blood glucose level at that time. Insulin to carbohydrate ratio. Each young person has an individual insulin to carbohydrate ratio. This may be different for different meals. This example is a 1:10 ratio, which means that for every 10 grams of carbohydrate, 1 unit of insulin is needed. Please refer to the young person's individual healthcare plan for their insulin to carbohydrate ratio. This is an example of 1 unit of rapid-acting insulin given for every 15 grams of carbohydrate. Please remember, all insulin pens can give half-unit doses. Therefore, work out the amount of insulin required to the nearest half unit. This is an example of half a unit of rapid-acting insulin given for every 7 grams of carbohydrate. Insulin sensitivity factor. This is also known as a correction dose. The ISF is extra insulin needed to correct a high blood glucose level, for example, before food. If the pre-meal blood glucose level is above the young person's individual target, you will need to calculate a correction dose. Again, please refer to the individual healthcare plan. This table shows how many extra units are needed at different blood glucose levels using a 1:3 insulin sensitivity factor. Calculating total insulin dose. The amount of insulin that is required is calculated by adding the amount of insulin needed for the carbohydrate to the amount needed for a correction. Calculating insulin dose scenarios. Using the insulin to carbohydrate ratio of 1 unit to 10 grams of carbohydrates and the insulin sensitivity factor of 1 unit to reduce the blood glucose levels by 3 millimoles per litre, calculate the amount of insulin needed for each scenario.